Okay, this lecture is called Popping the Pill Paradigm. And where this comes from is this is a picture of me when I was in my mid 30s, sort of early to mid 30s, and I was doing like a double fellowship in neuroradiology and endovascular interventional radiology to brain endovascular neurointerventional radiology. It's like being an imaging guided endovascular brain surgeon. Anyways, I was trying to do two fellowships at once. I wrote a textbook in interventional radiology that year, Pocket Radiologist for Amherst. And I got fat, had a kid at home with the wife. So I wasn't sleeping. I was drinking 7 cups of coffee a day. And then that didn't surprise me. I knew it was just one busy year, and I figured that would all go away as soon as I got back to regular so-called stable life. But then I couldn't lose weight for a couple years. And I got teased by my family. My sister-in-law told me, look, if you know so much about nutrition, then how come you're so fat, Mr. Doctor? And I knew she was right. So I devoted myself to figuring out how to lose the weight and understand nutrition at that point. I thought I knew nutrition. I was like just about the best student, if not the best in the whole United States in biochemistry as a medical student. And that's considered nutrition, but I did not. So finally, I learned about nutrition. I went to the plant-based, starch-based diet. Studying the nutrition experts, including Dr. McDougall, was very helpful to me. And I went and I got a new house where I had a big backyard I could exercise. Here's a swimming pool in the backyard. So my weight went down from 220 pounds down to about 154 pounds. Now I'm back at about 165 because I feel physically stronger at 165. I wrestled at 158 in college. So 165 is a good weight for me, a little lighter than I was in college. So anyways, we're going to now go over what did this all lead to. Plus, I was also a little frustrated. My mom died of cancer. And all I knew when I was young was to tell her, go to the expert, go to the specialist. And her oncologist, I think, was pretty good and did the best he could for her. But what I didn't realize is most oncologists, they're good with chemo, but they don't know anything about nutrition. Okay, my father ended up going for open heart surgery, and I recommended the vegetarian diet. I knew about Ornish, but I didn't know that much. I didn't know it that well enough to have insisted he just do the dietary thing. And he came out of the surgery pretty well. But he, 4 years later, dissected his vertebral artery, shoveling snow, throwing it over his shoulder. And I think it's because he had a lima to the LAD, left internal mammary artery, stapled down to the left anterior descending coronary artery, a typical thing with coronary artery bypass grafts, CABG, cabbage. And I think that's why he dissected. He probably wouldn't have dissected because he'd been shoveling snow, throwing it over his shoulder all his life. He had a big stroke, had to retire at that point. It was sad. And so I was a little disappointed. And I had other family members and friends who would ask me medical questions, and I would always just say, go to the specialist, go to the expert. I didn't really know that much outside of my own field. And here I was, fat, and I couldn't even fix my own problem until I started studying it outside of conventional training. I had done a fellowship at Harvard with the emphasis on vascular disease, and I really thought like a typical interventional radiologist, a plumber. Okay, here's a blockage. Here's how you do an angioplasty or a stent. Here's how you dissolve a clot with clot-dissolving medicine like TPA and whatnot. But I really didn't understand the pathophysiology of atherosclerosis that well. So anyways, I think that's a common problem for lots of doctors, and we're going to talk about that. And that's why I call this popping the pill paradigm. For dental school, the motto is drill 'em, fill 'em, and bill 'em. Okay, I didn't even realize how common that was until I saw it happening. The med school motto is match the ill to the pill and send a bill. I remember when I was in medical school thinking, this is great. All I need to know is make a diagnosis and then match it to the medication for that disease, and, the patient's cured. It wasn't until later, when I was out in practice that I was realizing, gee, these patients take these pills, but they don't ever get better. By definition, chronic disease means the patient never gets better. Most diseases are chronic, meaning that most patients don't get better. And doctors are trained to expect that the patient will never get better. It's just normal. You never get better. It's just normal in America that you expect a person over 50 to be fat, pre-diabetic or diabetic, and hypertensive, and have coronary artery disease. And if they're impotent, that's common. What do you expect? They're over 50. In these centenarian countries, you got guys, in their 70s with young wives, having kids, okay? No Viagra. All right, okay. The point is, let's see, my motto is vegan today, vegan tomorrow, vegan forever. That's a little bit of a spoof on this one architect who I like, Pugin from England. But what's the point? What I'm trying to say is, yes, medications are an important thing in health. Of course they are. But there's a lot of things to think about, because I think what happens to a lot of doctors is they only think, what's the pill for this condition? I'm in a hurry. And they're under pressure to go as fast as possible, see as many patients as possible per day. All doctors are. And also, it's the same everywhere. Anywhere you go in America, this is the way doctors are trained. It doesn't matter what specific state they work in. This is how they are all trained, all of them. Match the ill to the pill and send the bill. That's what medicine is. And if the pills don't work, do a surgery, okay? Or nothing works. That tends to be the end of the line. And the reality is, when you optimize your diet, you increase blood flow to the tissue. Anything you want to heal heals better with good blood flow, good oxygen delivery, vasodilated arteries, they're wide open. The immune system functions better. Low-fat diet, you avoid diabetes, pre-diabetes, you get better mitochondrial function, and all your tissues function better. You get better perfusion of your skin, a vitality, a glow. You look younger, healthier, more energetic. Is the sleep adequate? Is the stress management good? All the stress equivalents, avoiding caffeine. Is the person getting enough sunshine to get your vitamin D? Always try to get it from the sun instead of a pill. If possible, it almost always is. Exercise. Are they avoiding toxins? A lot of people are exposed to stuff and they don't even know. So it's good to get a good exposure history. Okay, the point is, you try to prevent a disease first, then you try to heal it with diet and lifestyle. If that's possible, you consider it at least. Do a good history. Take a dietary history, take an exposure history when you talk to the patient. A lot of docs don't do that routinely. And then if necessary, consider a pill or a surgery. And it's good for certain things. And learn to see things in a historical context. If you look at the 1700s, you'd have the chief of medicine at the best universities in the world would be experts in phlebotomy. And they would exaggerate how phlebotomy is great for everything. And it is good for a few things. It lowers blood viscosity. That can be helpful in some situations, but that's about it. Okay, and in 1900s and currently, the chief of medicine is going to be somebody who's an expert in pharmacology. They know pills, but they're going to exaggerate the benefits of pharmacology. And also, in my opinion, doctors should be a role model of fitness, okay? Because they should have put a lot of time and thought into optimizing their own fitness. And if they haven't optimized their fitness, they should come watch my videos or talk to me, and I'll help them to do so, because a doctor should be a role model for the patient. They should look fit and strong and energetic. If they got a disease, they got a disease. But most docs that are fat and out of shape, it's because they don't know anything about nutrition. And that is a fixable problem, but you got to study it. Just because you got an MD, it doesn't mean you know anything about nutrition. All right? And most chief of medicine types, they exaggerate the benefits of pharmacology. That's where the money is. If you want to get grant money for research, almost always it's going to come for development of a pharmaceutical, testing of a pharmaceutical, okay? And again, pharmaceuticals have their benefits, but there's a lot more that can be done than that in medicine, and it takes extra effort to learn these things. The benefits of pills is exaggerated. They're good for replacement with end-stage disease. You lost your thyroid replacement, okay? Parkinson's, you lost the substantia nigra dopamine production, L-Dopa can replace that, okay? Doesn't change the time course of Parkinson's complications, but it certainly gives them better function for a while. Antibiotics, helpful for bacterial infections. So pharmaceuticals in these and other roles can have a great result. But if you want the best results, not just standard results, optimal results, you need to learn a lot about nutrition. It's the most powerful thing, the vegan diet. I've studied everything in medicine, from the surgeries to the pharmacology, and the most powerful thing in all of medicine is learning about nutrition. And people think it's a joke because they don't know any better. The Mediterranean diet is a joke. Good fats is a joke, okay? But the low-fat vegan diet is no joke. It's the most powerful thing there is. Let's take a look at some numbers here. Let's talk about the cure rate for obesity. You put people on a low-fat vegan diet, 100% are cured. They just have to eat that. No meat, not one bite. No oil, not one drop. No processed food, none. They do that, they're better, okay? And, spare me with this. People go, oh, well, that's too extreme, to be 100% vegan. People are willing to get themselves surgically cut up from the top of their chest to the bottom of their abdomen on a routine daily basis and to just improve their diet. That's rough. No, it's nice. It's nice to be healthy and fit. And this is how you do it, because that's how we're designed. Our metabolic physiology is designed for that. What percent of people can you cure of obesity with pills? Hardly any. You can cure people with bariatric surgery, but bariatric surgery has a lot of complications. It's painful. Patients sometimes die, get pulmonary emboli. They sometimes get neurologic deficits. They get B12 deficiency, some of them. They get plenty of problems. And don't get me wrong, bariatric has its place, but it's better to go low-fat vegan if the person can motivate themselves to do so. Hypertension, close to 100%, if caught within the first decade, can resolve their hypertension, keep their systolics below 160, not need any pills. What percent are cured from pills? 0. And this is like the most important, most common disease in people with aging is hypertension. 0% are cured. It's a chronic disease. 0% are cured with pills. Close to 100% are cured going low-fat vegan, low-sodium vegan. Diabetes type 2. If you catch it within 4 years, Rob Taylor's paper, close to 100% are cured. What percent are cured with pills? 0. 0. Are you getting this? It's 100 to 0. It can't be more different than that. 100% to 0. Coronary artery disease, Esselstyn's paper, July 2014, Journal of Family Practice. 99.4% who followed his diet, which is no animal products and no oils, no caffeine. 99.4%, no recurrent cardiovascular events. The one patient out of 198, about 200 patients, that had a cardiovascular complication was a patient who didn't follow the diet. He just included it to make his results look more realistic. But the point I'm making is, I hope you realize how extraordinary this is. Close to 100% to 0. If you had to choose between a treatment that works about 100% of the time and another treatment that works 0, never cures the patient, what would a smart person do? Okay, I would want the option that will cure me 100% of the time or close to 100% of the time. It's pretty obvious. Okay, let's say somebody has coronary artery disease. It's never cured with pills. By definition, it's a chronic disease. Now, you can save a person's life with a stent during an acute myocardial infarction. Yeah, I've seen cardiologists do incredibly wonderful things saving people's lives. But if you've got chronic coronary artery disease, which is what the vast majority of patients have, a stent's not going to change your mortality. No significant change in it. Okay, it can decrease the symptoms of angina. So it can play a useful role, but the smart move is Esselstyn's diet. Okay, low fat, low sodium, low caffeine vegan. He doesn't emphasize sodium so much, but I think he should actually emphasize that more. Okay, low-grade prostate cancer, the Ornish paper. Patients that went vegetarian. This was a group of patients with low-grade prostate cancer who were biopsy-proven, who had declined surgery or radiation for whatever the reason, and they just went vegetarian, and they kept their PSA stable or decreased them, compared to the group that just did watchful waiting with no change in their behavior or therapy. And a lot of them bumped up their PSAs and ended up having to go for other treatments. So that's sort of a special set. But I think the point is made. Pills have their role, but all this other stuff is very beneficial. And if you want to be the best possible doctor you can be, if you want the best possible health for yourself, you should learn about it. And it's real easy to learn. And I got a million lectures on it. You can learn this for free and save your own life, keep your Johnson working, and be able to enjoy life with good health instead of being worried about health problems. So hope it's helpful.